now let's say you got a cold. What kind of foods are you reaching for? What are you looking to take?
Okay, so if I got a cold, then I'd want something really warming and nourishing and something that's really full of those nutrients. I would go for a warming bowl of chicken soup. So something that's loaded in with lots of vegetables like carrots, celery, potatoes and turnip, because therefore you're getting the antioxidants coming in. Throw in lots of garlic, so we've got throw in cloves of garlic. Put them in whole as well. I mean, garlic is both antibacterial and antiviral, so it's certainly going to help if you end up with a secondary infection, which can be bacterial. The chicken itself is going to help, so chicken has an amino acid in it called cysteine, and cysteine really helps to clear out the mucus from your lungs.
You mentioned some vitamins in the beginning. Is there any supplements we should be taking once we do get sick?
Absolutely. Vitamin C. Yes. Vitamin C is dose dependent though. So you want to be having about 1,000 milligrams a day for prevention. And then if you get a cold or a flu, then you want to be having about 1,000 milligrams every hour. Those people that took 8 grams at the onset of a cold or flu, the next day, 49% of them didn't have their cold or flu.
Wow, so it's potent.
Yeah, absolutely. And then 4 grams, 39% of them didn't have a cold or a flu the next day. So it's all dose dependent.
What about orange juice? Everybody says, oh, make sure you're drinking your orange juice. Is that helpful?
Well, you've got to think about why you're actually drinking the orange juice. If you're taking it for the vitamin C, not really. So let's have a look. 1 glass, we've got 100 milligrams of vitamin C in just one, and we want to be having 1,000.
It's not enough.
That's 10 glasses of vitamin C that you need to be drinking. And not only that, the glass of vitamin C has 22 grams of sugar.
So it's a lot of sugar in that.
Yes, and not a lot of vitamin C.
I see. Any other fruits and vegetables that you recommend?
Oh, look, anything that's potent or rich in an antioxidant source. So things like pomegranate seeds, absolutely. Lemons are going to be great if you have a bit of a sore throat with your cold. You have a hot lemon and honey drink that's really nice and soothing. Persimmons, but just get those fruit and vegetables. So don't necessarily focus on one particular fruit or vegetable. Get an array, because that way you're going to get not just the standard nutrients, but lots of other phytonutrients as well.
We just showed you how Western medicine and nutrition treats and prevents the common cold and flu. Next, we'll show you how traditional Chinese medicine treats it. Dr. Chen, thank you for letting us come today.
You're welcome.
Today we're trying to learn about colds and flus. Could you explain to us a little bit about how Chinese medicine looks at colds and flu?
Yeah, sure. Cold and flu is a kind of a common disease. Usually happen in the winter or spring or autumn, but any season can cause. But usually from the weather suddenly change. Cold, like common cold, is many people can get very easy. Flu is epidemic diseases.
And in the West, we commonly think of viruses and bacteria. In traditional Chinese medicine, do they also look at it as a type of virus?
In Western medicine, they talk like bacterial or virus, like flu, they caused by the virus. But traditional Chinese medicine, they started 2,000 years ago. We don't have a bacterial or virus, but we talk like a different terminology word, like pathogenic factors. We have cold, damp, heat, or dry.
In terms of the patient getting the cold, do they usually have some type of immunosuppression, or are they usually a little bit weak?
Yeah, every people to get sick or cold or different disease, the one reason from inside, maybe immunity low. By traditional Chinese medicine, qi is energy. If weak, or maybe cause disease. The basic treatment, people need increase the immunity treatment.
And then how would you go about treating that?
The regular treatment for cold people who with cold, we have a regular acupuncture, relieve the cold. For very patient has the symptom very light beginning. But if a patient have a fever or have like a sore throat or cough, we have to use a different therapy. We use like we call bleeding therapy and with cupping. So we'll be take blood out from the point, acupoint, and then can release the fever at the deep heat inside.
You use the word cupping.
Because after cause bleeding, we put a cup, it's negative pressure to remove the blood out. Western medicine, the doctor usually this time give antibiotic or something for anti-infection. But we use that therapy, very traditional, but the fever can be reduced immediately too.
Is it painful?
Not very painful. Sometimes like a mosquito bite, maybe. This is the treatment that they taken very quickly and sharp.
I see.
Another one also we do for moving cupping. This one on the back usually follow the UB, we call the urinary bladder meridian. So for example, that's the model. You see the many lines, we call meridians. So we move on the back. Usually this from this young side to release exterior. And then like a wind or cold or heat, any pathogenic factor removed from the meridian. We move the cups.
Gua sha, can you explain what that is?
Gua sha, they use a special tools and then also affect on the meridians. And only they have scrub on the body.
Does it leave any marks to the skin?
Yes, have the mark will be take 3-5 days, even week, but it will go away.
What about herbs or medications?
Yeah, we do have around 400 individual herbs in my pharmacy, but I create the formula for each patient.
Is there any particular foods you usually advise people to eat or drink during this time?
Yeah, we usually give people some suggestion, recommend, depend the common cold caused by wind cold or wind heat. If from the wind cold, we will suggest people to go home, buy some ginger, ginger from the supermarket, they cut pieces, and cooking the soup. If from the heat, wind heat, usually have a sore throat or something, we suggest the patient go home to make a green tea and put a little bit of honey or lemon and drink it.
Because in the West, we have wives' tale about eating chicken soup when you get sick. Do Chinese people have a kind of custom that they usually do when they're sick?
Oh yeah, but chicken soup or beef soup or fish soup doesn't matter. But not for common cold time. This kind of soup is for tonification. For people, deficiency or weak, but no symptoms have infection. But that soup can use after common cold relieved.
Do you have any recommendations to help people to stop them from getting the flu or from the cold?
In traditional Chinese medicine, we have a lot of things to talk about. If people who have immunity low or deficiency, they have to take something, even by the food or diet, like nourish food we mentioned, but also may take some herbs